Long-term use of the lithium is associated with which endocrine abnormality? Classically with hypothyroidism. So what are the side effects of lithium? L is leukocytosis and lethargy, easy to remember. I is insipidus, which is diabetes insipidus. T is tremor and teratogenicity in the form of Epstein's anomaly. Then H is hypothyroidism, I is increase in weight gain, and U is vomiting, and M is metallic taste, and ECG changes and acne is what you have to basically remember. Then in the same light, we should remember the other important antipsychotics. Basically lithium is used for maniac depression, bipolar illness. Then what are the side effects of antipsychotics? Generally, what is the cause of the psychosis? The cause of psychosis is dopamine excess or dopamine deficiency, doctor? Basically in our brain we have basal ganglia. Can you give me a little volume? Basal ganglia, and we are having a limbic system. There is D1, D2, D3, D4 are the 4 different types of dopamine receptors. If the dopamine comes and binds with our D1, then our movement of the body will occur in the basal ganglia. If the dopamine comes and binds with D4, it makes us a happy individual. We are happy if we have dopamine adequately. If the dopamine levels are high in our D4 receptors, we are overexcited and we will become psychotic and start beating our roommate. If the dopamine is very low, then we are so depressed and we feel like jumping from the window. So all because of dopamine के हाथ में हम कठपुतलियां हैं. So if you use an antipsychotic, it is an antagonist at the D4, provided it is selective. Suppose if it is not selective, what will it do? It will antagonize D1, D2 and D3 also. If the D1 gets affected, what will happen? Movement gets affected. So non-selective antipsychotics will affect the movement, and extrapyramidal side effects are the main complication of typical antipsychotics, which are typically non-selective. Whereas clozapine, olanzapine, they are all the drugs which act selectively on the D4. That is what you have to basically remember. So, sedation, hypotension, anticholinergic effects, dermatological side effects and endocrine effects like impotence and gynecomastia, they are all basically related to antipsychotics. Why impotence? Mind is the biggest sex organ. It is not the peripheral sex organs of the body. So impotence can be vasculogenic, then it is peripheral, but good number of people it is psychogenic. And what is very important in the limbic system, serotonin levels are important. In the limbic system, serotonin to decide the potence. So antipsychotics which have an effect on the serotonin levels in the brain can land the patient in impotence, and since they affect the dopamine is an inhibitor of prolactin. If the dopamine is inhibited by them, prolactin is no more inhibited, because dopamine is inhibitor of prolactin. If the dopamine is inhibited by the antipsychotic, there is a disinhibition on prolactin levels, prolactin increases, and that leads to gynecomastia, which is a side effect of dopamine antagonists. Then what are the side effects of antidepressants? Remember as shacks. Once more, sedation, hypertension, anticholinergic, cardiac, seizure and sexual. Then antimanias like lithium. Already we discussed lithium is the name spelling only, you can remember everything. Now lithium is not used in the treatment of which of these conditions is a very important question. It is used in major depression, muscular headache, since it leads to leukocytosis. Just before we said no, lithium increases the leukocyte count. It is used in the management of neutropenia, but not in generalized anxiety disorder. What is generalized anxiety disorder? MD entrance notification नहीं आए तो tension, आ गए तो tension, दूसरे तरफ की tension. So always there is an anxiety for both the things. Until it doesn't come, we feel that these Indian exams and all this we keep shouting. After the notification comes, array, I wasted all the time and I don't have time to read, is the worry. So don't worry, doctor. And anxiety, worry, they are the things that actually bring a memory loss. That's what Bhagavad Gita, Kamat Bhavati Krodaha. Because of the desire comes the anger, because the anger comes the depression, because the depression we get the forgetfulness. That is the reason what is depression called as pseudo dementia. So that is the reason if you are a good entrance aspirant means sthitari munivruhyati. The mind must be stable, noble, agile, and you should not be easily disappointed by anything nor over-related by anything, and maintain that equilibrium, then you will definitely win, doctor. So lithium is prescribed for what? For severe depression, bipolar disorders, neutropenia, vascular headache, etc., etc. Now, in mania, what are the various drugs that we use? Typically we can use carbamazepine in maniac depression. There are some drugs which are used as a prophylaxis to prevent the episodes. Risperidone, though it is an antipsychotic. Then olanzapine, though it is antipsychotic, we still use it in mania, but not chloropromazine. Chloropromazine is also an antipsychotic, but it is a typical antipsychotic. That's the reason we don't use it in the management of mania. Chloropromazine typical means non-selective, both on D1 and D4. So what is the CALM protocol, CALM, CALM protocol in the management of bipolar disorder? C means control maniac and mixed symptoms. A is use antidepressants very selectively if at all. Why you don't want to use antidepressants on a bipolar illness? Bipolar is mania on one side, depression on other side. Without giving a mood stabilizer, if you give antidepressant, depression निकल के मेनिया बढ़ जाएगा और पेशेंट वेंटिलेटर में बैठ जाएगा. इसलिए पहला देना mood stabilizer. Then you need to give adjust antidepressant at most have got an adjunctive role, not the main role. Then long term view and give mood stabilizers. Now tell me what are the mood stabilizers that we give? Lithium, Divalproex, carbamazepine, lamotrigine. Don't forget. ये सब चीजें एंटी एपिलेप्टिक क्लासिफिकेशन में आता. Lithium, Divalproex, carbamazepine and lamotrigine. These are the 4 drugs which are used as mood stabilizers is what you need to remember. So don't worry that मैंने पहले बार सुन रहा हूं कि Divalproex क्या है, मैं पहले बार सुन रहा हूं lamotrigine का इस्तेमाल मेनिया में मूड स्टेबलाइजर में भी करते हैं, मैंने खाली सोच रहा हूं कि एक एंटी एपिलेप्टिक है वो. या वंस यू गो थ्रू ऑल द 190 क्वेश्चंस, सेकेंड राउंड आप जब देखते ना, दिस ऑल द इजी थिंग्स एंड आफ्टर यू गेट द सीट एनीवे यू डोंट नीड ऑल ऑफ देम, बट इफ यू डोंट गेट सीट यू नीड ऑल ऑफ देम. सो व्हाट आर द ड्रग्स यूज्ड टू ट्रीट बाइपोलर disorders? Lithium, lorazepam or clonazepam. They can be used for whenever a maniac patient is acutely agitating. Then lorazepam, clonazepam. Then sodium valproate is given. Carbamazepine is not FDA approved, but still off-label indication. Then topiramate, zonisamide, haloperidol, and You can also give olanzapine, quetiapine, risperidone. These are the various things that you can give. Most of the antipsychotics, antidepressants you can give. That's the whole idea. Only thing is, typical antipsychotics don't give. But let's close the story. Now, what is the minimum duration for the diagnosis for you to call mania? 1 week. That is the reason we don't continue Monday and also Tuesday day long class. One day it is mania, is physiological. Morning 9 o'clock to evening 8 means. One day we will give break, like a drug interval, and Wednesday we are conducting today. Full 1 week if we conduct like this, morning to 9 to 8 means, we perfectly fit into definition of mania. So doctor, one of the favorite question of the examiner is, what is the minimum time duration for you to diagnose a given condition? When will you call major depression? 2 weeks. Then major depressive disorder, 2 episodes separated by 2 months. Dysthymia, if that feeling of blue is continuing for about 2 years. Cyclothymic disorder also 2 years. Maniac episode, for you to call 1 week maniac state mein hona. Then hypomaniac to call it as 4 days. Already Saturday subject is Sunday grand test. Monday and today is Tuesday means we are almost in a hypomaniac state. Then rapid cycler means at least 4 episodes per year. And slow cyclers means 1 to 3 episodes per year. And postpartum mood disturbance means up to 4 weeks after delivery of the baby, you have a privilege to slap your husband and say, sorry dear, it's a postpartum mood disturbance, I could not help it. Beyond 4 weeks, he will go to the judge and say, I can't bear it anymore. So, a patient is depressed for past 3 years. So, dysthymic disorder is 2 years. Do not go out of his house much. He is cut off from society, but he has got a normal sleep and normal weight. What is your diagnosis, doctor? Should be? It is classically dysthymia. To call dysthymia, more than 2 years is what you have to basically remember. Right? So, if you happen to get into an MD which you did not want to, you want to be pediatrician, you got an MD microbiology. Yeah, Khalil sir is maniac in spite of finishing MD microbiology yesterday, day before yesterday. So, 3 साल आप दरवाजा बंद करके बैठ गए तो 3 years MD is over. So, dysthymia is more than 2 years. Now doctor, what are the clinical features of mania? World famous mnemonic disease. Dig fast. Dig fast. Dig fast to get into graveyard. D is distractibility, indiscretion, grandiosity. So, he will have 1 crore of debts. He will go and buy a BMW. So, grandiosity will be there. Then, one of our friends said, one of my classmates sent a WhatsApp that I bought a BMW 750. Everybody were, you know the joke, BMW, everyone congratulated. Then he said, I bought a Balaji masala wafer, 750 grams. It is 1.9 crores wala car. Oh, so activity increase, sleep difficulty, talkativeness, yeah, they are all the features of mania. Then how do you remember dysthymia? 2 years, you will remember the duration. He is too sad is the way to remember. Hopelessness, energy, loss of fatigue, self-esteem is low, 2 years. Depressed mode, sleep is increased or decreased, appetite increased or decreased, decision making is impaired, etc., etc., is what need to be remembered. Whereas in children to call dysthymia, 1 year is enough. A child 1 year unhappy means we should be disqualified as a parent. Right? So, depression. What are the important ways to remember? Of course, we don't need a mnemonic. We are experts in this. Right? So, C gasp die. Okay. Now, what are the risk factors for suicide in depression? Whenever, as a clinician, you are taking, can you give me the focus? As a clinician, whenever you are taking the history, you should ask him, do you have that tendency for, and leave the fill up the blank. If the patient says, for suicide? Yeah. So it is a question permitted to be asked, because someone who repeatedly says, I want to commit suicide is going to. So you cannot take it easily. So between men and women, who will commit suicide, doctor? Successful in men will be successful in finishing the act of suicide until the completion of death. Whereas women are known to threaten that they are about to suicide, and ultimately men die because of 2 reasons. Right? So, what are the risk factors of suicide? This is one of the most repeatedly asked question in PGI, AIMS and all exams. So, some people suffer involutional depression. Involutional means you became a professor, you have retired. Ultimately, you will think, what are these folds on the skin? All my life I have been only spending time in operation theatre. Every batch I had been failing the students. That is the only carnival, connubial, dog-like pleasure I had in my entire life. So, he will suddenly feel one evening of winter and next day found dead. Involutional depression. So, that's the reason elderly people, when they have depression, don't say that you are bound to depress. Okay. So, then if they also have personality disorder plus depression, more likely to die. Then if he is more than 45 years old male, right, middle age crisis. If he is unemployed, single, divorced, right? Why divorced people are more likely to commit suicide than married people? Married people will be killed without dying every moment, every day. So that is the reason death will not come that easily. So you need to be divorced in order to have a successful suicide. Then those who are chronically ill, widowed, recently buried, family history, they are all the well-appointed risk factors. Now, what is the maximum risk of committing suicide again in a previously attempted suicide patient? That means एम्स लिखने के बाद पीजीआई में फिर सेम क्वेश्चंस को रैंक करने का चांस कितना होता? That is the question. Living alone or divorced gives an opportunity to die comfortably. So the chance of suicide is higher if you are living alone or divorced. That's very important. That's the reason if you are divorced, at least grow a pet, a dog or cat. It will say, please don't do that, dear. I am here for your entire world. So you won't die that easily. Then what is the management of suicidal tendency in depression? Electroconvulsive therapy is indicated whenever there is a suicidal depression. What is meant by bipolar disorder 1 and disorder 2 is an important question. Basically, bipolar disorder 1 means mania cycling with the depressive episodes. Bipolar 2 means hypomania cycling with depressive episodes. And what is cyclothymic? Hypomania cycling with episodes which are lesser than to be called as depression. That is the typical definition frequently asked in exam. So how do you diagnose hypomania? What is called hypomania? Mania, anyway, you know, jumping to the ventilator. Then what is hypomania? Tad high is the mnemonic to remember. They are talkative just like mania. They have attention deficit just like mania. They too have decreased need for sleep, and they have a high self-esteem, grandiosity about themselves. They have a racing ideas, and they have a high risk activity, and goal directed activity is increased. So this defines what is called as hypomania. So when hypomanic episodes plus depression, you call it as bipolar? Two. Then greatest psychiatric burden to the society is what, doctor? Depression is the biggest burden to the society. Sometimes if you are very successful also there is a depression. Why? Depression has idiopathic reasons. If there is a reason, there is no more, you will anyway solve the reason. So that's the reason, that's the point. So now doctor, if you don't treat mania, how long episode will last? 3 months. Then there are few things about mania you must remember. If there is one single maniac episode, 90% of them will have another maniac episode. And whenever the bipolar illness duration increases, the time between one episode and the other episode start decreasing. And after about 5 episodes, the inter-episode interval stabilizes around 6 to 9 months. 6 to 9 months. Typical marriage, doctor. Initial days, almost every other day they fight, and when it is night they switch off and then have a good activity, and once more morning, ting ting tuk 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 tuk, you will be listening all the sounds in the bowels and fighting episode. For a period of time you will be thinking, since long time we are not listening sounds. Suddenly after 6 months or so, there will be once more big sounds of each other. So 6 to 9 months. And typical number of episodes, around 5 to 15% of the people will be rapid cyclers. And to call rapid cycling, what is the golden number you should remember? 4 or more episodes in 1 year become rapid cyclers is what you need to remember. For acute bipolar disorder, what is the treatment of choice when the situation is in an acute way? So lamotrigine is the one which is basically used, and generally the combination is of SSRI. What was given in the question? Acute bipolar. Ideally we should have SSRI with a mood stabilizer. Already you know now what are the mood stabilizers? What are they? Divalproex, lithium, carbamazepine, lamotrigine is also there, but lithium is also here, right? But the point is, after using fluoxetine like SSRI with mood stabilizer, if the response doesn't come, then lamotrigine is the next choice. Okay, then electroconvulsive therapy is also another option available. Then what is the role of lithium in acute bipolar illness? Lithium, valproate, carbamazepine have main role in maintenance, and for acute management, most important drug to be used is SSRI with a mood stabilizer, if not responding lamotrigine, and if suicidal tendencies are there, then the electroconvulsive therapy. Now what is the treatment of acute maniac episodes? Once more, 2003 and 4 question. Acute only mania is there. Acute maniac episode. So sodium valproate typically is used. Earlier days they used to use lithium, but sodium valproate has proven to be much more efficient and efficacious than the lithium. That's the reason the answer becomes sodium valproate. But the point is, If you take sodium valproate versus lithium, lithium can be used for an acute episode and also for maintenance. But sodium valproate's role is only there for acute episode, is what you have to basically remember. What is the main adverse effect of sodium valproate, doctor? Clinically? Weight gain. Weight gain is the main issue. Learned helplessness. Where do you typically see learned helplessness? Come on, shoot an answer, doctor. Yeah. Depression. What is the meaning of learned helplessness? Actually, it is an experiment which was done by Seligman. What did he do? There is an area where there is no shock, and there is an area where there is shock. If you give shock to a dog, it will jump to the area where there is no shock. But you remove this shock-free area, and for some period of time you give continuous shock to the animal, it is still living. Then once more you keep shockless area, and then once more to that animal you give shock, it will decide to not jump anymore. That's called learned helplessness. Shall I tell in simple terms? You took DNB CET, doctor. You got negative marks. All questions went wrong in 300, 250 went wrong. Immediately we conduct another entrance exam and say that you have entrance in another 60 days. So to that guy you ask, you read, these are only 20 questions, if you read you will get seat, please read only these 20. Say, no, I will not read, I am not ready to read, I am born to fail, he will say. So that is called learned helplessness, so don't go into that. So the most common post-operative psychiatric condition is what? Once more, depression. So post-MI, post-surgery, postpartum, HIV, myxedema. In all these things, the most common psychiatric illness is depression, is what you need to remember. So what is the most common age for depression? Who? Male or female? Middle-aged female. Middle-aged female is the most common age for depression. Okay. Then why middle-aged female? Because middle-aged male is most common age for suicide. So they are all dead. So there is nobody available for depression. Whoever depressing is only middle-aged female. I mean middle-aged female. Then neurotransmitter, which is decreased in case of mania, is which one? Mania? Noradrenaline. So norepinephrine and dopamine decreased or increased was there? Increased, yeah. Norepinephrine, dopamine are increased in mania. Norepinephrine, serotonin, dopamine are decreased in depression, is what you have to basically remember. So the minimum time which is required to diagnose depression, doctor, with a daily manifestation for 2 weeks is what you have to remember. That is the first topic of still it is still few more questions are there. DSM-4 is that international guidelines forming body in psychiatry to define the illnesses. Then DSM-5 has come now. If you don't get seat, you will also have to face 6. So what is the difference between the two? When it comes to psychiatric disorders, there are 2 main differences about bipolar illness in DSM-5 compared to 4. A new diagnosis, disruptive mood dysregulation disorder, is being framed. Earlier bipolar 1, bipolar 2, hypomaniac, maniac, all those things are defined. No? In DSM-5 there is a new condition that has been incorporated, and definitely they are going to ask a question on this. What is meant by disruptive mood dysregulation disorder? Typically, if there is a persistent irritability and frequent episodes of extreme behavioral discontrol, then children up to the age of 18 years, they are classified under disruptive mood dysregulation disorder is what you have to basically remember. Okay, so be sure to marry a medical husband or medical wife. Why? It's a simple non-medical wife. She says that today is our marriage day, you didn't turn up, I am depressed. But your medical spouse will say, I have a disruptive mood dysregulation disorder that can lead to development of that may be an indication for ECT. So you have to run around. So be sure, when do you call? Below 18. Then dysthymic disorder is another important thing that earlier DSM-4 we used to call dysthymia. Now it falls under the category called persistent depressive disorder according to the DSM-5, where the patient has got a chronic major depressive disorder is included under persistent depressive, and the earlier dysthymic disorder was there, no, where for about 2 years घर में ताला बंद करके बैठने वाला डिसऑर्डर है ना, dysthymic disorder, उसको भी लाके कहाँ लगाया? Persistent depressive disorder is what you have to basically remember. So where do you see pseudo dementia? A depressed person forgets, and that is not a true dementia but a pseudo dementia. Then which is a mood stabilizing drug out of all these things? Valproate. Valproate is a mood stabilizing drug. Divalproax. What? 20th question. What is the answer? Oh, 20 missed. Sorry, it is not there here. I'll come back on that. Now, what drugs are mood stabilizers, doctor? Lithium, valproate, carbamazepine. And the newer drugs which are mood stabilizers are lamotrigine, topiramate, tiagabin, levetiracetam, zonisamide. Almost all anti-epileptics are all mood stabilizers, but mainly lithium, valproate, carbamazepine. What is the suicide rate in India? 11 per lakh population. Thank God, not 11 per 100. Medical school admission is 100, but generally medical college mein how many will be there? Earlier days, highest suicide rate means medical school. But nowadays, I am rarely listening medical school students. Lesser. In our school, medical school days, about 20 years back, highest rate means medical students. So the suicide rate in India in 2011 is 11 per lakh is what, and West Bengal is highest suicide rate. How do you remember? गंगा कहाँ बहती है डॉक्टर? आपको कलकत्ता सिटी के बीच में से, so you have got a nice what you call bridge, Howrah bridge to jump. I mean, on an easier way to remember. Already there are a lot of things. Where is the highest maternal mortality rate in India? Oh, good. At least you didn't forget what we discussed 2 weeks back. Keep reading, doctor. Some things which you frequently forget, no, values and all. There are बीच में चाय के लिए गए तो. Then what is the bad prognosis in a major depression disorder? So basically, multiple episodes is what need to be remembered for the relapse के लिए, and male gender is a risk factor for suicide with depression. For relapses, major predisposing factors, multiple episodes. Then an anti-epileptic was found successful for the treatment of tonic hind limb extension. Actually, I don't know how this question came. Generalized tonic-clonic seizures के लिए whether anti-epileptics work or not is basically checked by checking whether they are effective on a tonic hind limb extension in a laboratory animal. Forget about that question.